Measles has been in the headlines in recent weeks as an outbreak that originally started at Disneyland in California spread to other states. New Mexico had one case of the measles in December, but that was not connected to the current outbreak. Now, here in the state, vaccination rates are fairly good, but there are concerns among some healthcare providers about maintaining those rates in the future. Our producer, Sarah Gustavus, spoke about the issue with Dr. Melissa Martinez from the UNM School of Medicine.
Dr. Martinez, thank you for being with us.
It's my pleasure.
You know, when we see these stories about measles around the country and the news coverage of it, I think one of the first things people think of is, should I be worried about my children or grandchildren here in New Mexico?
I think that's a great question. And we do have a relatively good rate of immunizations in New Mexico. The trouble is that there are certain pockets where people aren't as well immunized. I often think of measles and other diseases as like a forest fire. And so people are reassured because there's no flames burning, but there are a lot of embers, in other words, people who are sick, who get measles in other countries, and come over and they can reignite the forest fire. And every child that's not immunized is like a piece of kindling for that forest fire.
What are some of the reasons why children in New Mexico may not be getting immunized for diseases like measles?
Well, access a lot of times is an issue. In New Mexico, we're very, very fortunate to have a really good supply of immunizations, especially for children. It's a little bit more difficult with adults. Some people have religious or other reasons or other beliefs that make them reluctant to get immunizations. There have certainly been a lot of theories and myths, especially about the mumps, measles, and rubella immunization.
You've been working on this issue for decades. What do you say to parents who say, I've read this or I've heard this and I'm concerned about vaccines?
Well, I think it's always okay to have healthy skepticism and to talk to your doctor about what your questions and concerns are. In terms of the measles vaccine, I would say that this is a vaccine that's been out for over 50 years. And if we were going to see something, we probably would have seen it by now. Number two, there was a scare about measles and autism. The doctor that did that, Andrew Wakefield, was pretty much discredited. In fact, he lost his license because he was promoting facts that were not correct. The CDC and the Institutes of Medicine have both extensively looked into in particular the measles, mumps, and rubella vaccine, and not found a lot of, and found absolutely no correlation with autism and MMR and not any other diseases that we are aware of. Now, there's no vaccine that's 100% safe. In fact, I don't know a medical intervention that's 100% safe. But this vaccine is pretty darn good. And there are a lot of vaccines that the risk of getting the vaccine is outweighed by the risk of getting the disease, and MMR is one of them.
New Mexico's been at the bottom as far as vaccination rates in the past, but we're not anymore. What's working here in the state to make sure that children are being immunized on schedule?
Well, like I said, New Mexico has done pretty well. One of the reasons is that we have this thing called universal purchase, whereby the state actually purchases the vaccine and sends out vaccines, a supply of vaccines, to every healthcare provider in the state. In exchange for doing that, the healthcare providers try and make sure that their kids get immunized. They consent to audits to make sure that they're immunizing their children, and they follow quality and safety guidelines for the immunizations. It's been a fairly successful program. It's under some threat right now. And the reason is that there's two funding streams for universal purchase. One is from the federal government, and the federal government pays for kids that are on Medicaid, for kids that don't have health insurance, and for Native Americans. And that makes up about 80% of the children that get immunized in New Mexico. There's another 20% of children that have private health insurance. When universal purchase started several years ago, I think it's been at least a decade, the insurance companies, the health plans, were very, very good about reimbursing the state for the immunizations that their children received. That's become more of a problem recently with new health plans moving in and other kinds of things. So last year, the state of New Mexico had a $3.5 million shortfall in the amount of funding that they have.
So what's the way to fix that?
Well, thank you for that lead-in. Senate Bill 121, sponsored by Senator O'Neill and Senator McMillan, would regulate that every health plan that insures children in New Mexico would pay their fair share into the fund.
Is this a controversial bill? Any concerns, any pushback from industry?
Of course. Some of the health plans have been very, very supportive. Some of the health plans are opposed to it. Some insurance companies, some pharmaceutical companies that supply the vaccines worry that the state will be able to leverage a good price for it, and that they won't get the compensation that they would like for their vaccines.
How are vaccines part of making New Mexicans healthier? We always talk about how the state's often at the bottom in so many measures of health and well-being, especially for our children. How are vaccines part of that discussion?
I think vaccines are the cornerstone of that discussion. You know, I was out in northern New Mexico, out in this little rural area once, and I came across this ghost town. I wouldn't really call it a town, like a ghost community. And attached to that was a graveyard. And in the graveyard, there were, I was shocked that there were several beautiful gravestones, but most of them were for children. And that was from 1900s, that the children had passed away. And I don't know why they died, but it's a good bet that a lot of them died from diseases that we can prevent with vaccines. Now, we are so blessed to be in New Mexico in this day and age, where we have a way of protecting our children. Most of us expect that our children will grow up, and we don't imagine that they're going to die of a vaccine-preventable disease. To not take advantage of vaccines is just to let this opportunity slip through our fingers.
And what do you see for the future? Do you think that there are any other threats for vaccination rates, any other concerns ahead that we need to be looking at in the coming months or years?
Well, there's always threats, and vaccination rates go up and down, and it's a continuous, we have to continuously monitor. We have to be honest with people about what the vaccines are, and also be honest with them about what the side effects are. So that people are willing to get the vaccines. We have to ensure a good supply of vaccines. The cost of vaccines is going up and up and up, and we have to find creative ways to finance vaccines so that we can make it worthwhile. Currently, for every dollar that's spent on vaccines, we save $3 in direct costs and about $10 in total expenses. But we need to keep that margin. The other thing that we've been working on is making sure that when a child is seen in one doctor's office, they have an accurate record of what vaccines they got when they're seen in another doctor's office. So we're working on an immunization. We've been working for a number of years on a statewide immunization system. I think we have to find ways to finance adult vaccines, which has always been a little bit more of a problem.
We'll have to pick that up again another time. Thank you so much for joining us today.
My pleasure. Thank you.